we are focusing on specific genetic aberrations nowadays, which let us to have an impact on specific biological pathways of the tumor. So we are trying to identify the minimum number of genetic aberrations which will enable us to tackle them and to stop tumor growth and to induce tumor regression. So the effort is to identify those critical pathway aberrations in order to tackle them with the new drug. This is our current effort. I think that the challenge is to be able to put everything, to have a comprehensive approach to the patients. I mean, including into the decision-taking process, including the clinical data, including the established histopathological features of the tumor, adding the biological characterization of the tumor, and finally adding those molecular assays and molecular data that may be relevant for the patient. It may not be the same for all patients. The question is, we have to be able to ask the proper question for each individual patient, and then to be able to use the proper assay to address that question. There may be questions that may be solved just with the histopathological features of the tumor. No need for sophisticated assays, but whenever questions remain to be addressed, then we have to be able to add assays over assays in order to try to address the question. So it's a complicated approach. It's a multi-step, kind of hierarchical approach to the tumor. I don't think there will be a revolution in the way we are looking and treating breast cancer, but for sure I think we have to put order in the way we are tackling the different problems. Again, starting from basic approaches to a little bit more sophisticated, and opening the door for the most sophisticated approaches, but not for everyone, not in all circumstances. We should be good enough to identify the proper assay for the proper question. And take into account the fact that not in all the countries, not in all the places, these are affordable. So it may well be that the way we are thinking of patients in Western countries has to be adapted to countries that are less lucky than Western countries. Because this should be a message, or should be a consensus that has to be true for all the world, not just for a few happy and lucky